Hey, I'm Luke Schellenberger. I'm an ENT doc. So, one thing that we do as ear, nose, and throat doctors is to take care of head and neck bumps and lumps and things like that. One you might not be aware of is little tiny glands about the size of peas called the parathyroids. These things are actually super important. What the parathyroids do is they release a chemical, parathyroid hormone, that goes throughout our body and regulates the calcium level between our bones and our blood. And so if parathyroid hormone goes up, it tells the bones to release more calcium into the blood. Well, that's a problem if one of the parathyroids decides it's going to release too much of that hormone. And all of a sudden we can actually have way too much calcium in our blood, which causes problems with muscles and causes other symptoms too. But also, it starts to make the bones a lot weaker. And so this is what's called primary hyperparathyroidism. Long name. But the treatment is usually pretty easy. About 90-95% of the time it's due to just one parathyroid that's gotten too big, called a parathyroid adenoma, and it's creating too much of this hormone. ENT doctors actually, it's not that hard to go in, find that gland, and remove it. And there's new technology all the time that's helping us be able to do that more effectively. One of the newer ways that we can determine that we've taken out the right gland is what's called rapid PTH testing. It's actually done in the hospital where immediately we'll draw a blood level right after we've taken out the gland we think is the wrong one. And at the same time, well, within about 20 minutes or so, pretty fast, we'll get a result back. And obviously the whole idea is that our parathyroid hormone level will drop back down to a normal range. Kind of cool. But anyway, I just wanted to talk a little bit about parathyroid disease. This is something that most people don't even think about unless they go to their doctor and get told, oh, your calcium level's too high. And then they got to figure out, well, why is that? So they get their parathyroid hormone level checked and it's too high. And then we have to have special tests to make sure, kind of see which parathyroid gland it is. But anyway, if your doctor says, oh, your calcium level's too high or parathyroid hormone level's too high, I take care of that kind of stuff. Give me a call.